So if you can't take hormones or HRT isn't your jam, what can you do? Oh, there's a lot. So I am known for helping people make healthy habits and wellness. I am a physical therapist. That is my jam. The only reason I started talking about HRT was because I noticed there was a stigma, and at some point, many of my patients needed something more than what I could offer. And I thought there is a gap in the education of what we have as women. And I just wanted women to know that it wasn't the bad guy that the Women's Health Initiative made it out to be in 2002. But with that being said, let's talk about things you can do that are not related to HRT. So the way I like to think of it is, as we age, we have to try a little bit harder because we're a little more inflamed. So estrogen helps us broker inflammation. So inflammation is something I fight every day as a physical therapist. That's what causes joint pain, your tendonitis, all that stuff. So if you have inflammation, I want less inflammation. So how do we get less inflammation? Step one, I want you to learn to rest. I want you to get sleep at night. It's not like when we were in our 20s that you could pull an all-nighter and be fine. You really need to learn to sleep and rest. If I could pick one thing for you to do, it would be to learn to sleep and to prioritize sleep, because the lack of estrogen means we don't buffer and handle cortisol, the stress hormone, as well. One of the best things you can do is sleep. If I had to pick between you exercising or sleeping, I would pick sleep. Seriously. Number two, I think you can't supplement your way out of a bad diet, so your diet needs to change. So as we all age, men and women, we don't deal with protein as well. Like, we need more protein to have the same effects. So as women age, we're losing muscle bulk. I need you to consume protein, 100 grams of protein a day, which basically, if I can get you to do 30 grams of protein each meal, we're doing amazing. Most people do not get more than 60 grams a day. Most Americans do not. That is not enough. So I would love you to think about protein. Next, I would love you to think about your fiber. Fiber helps your gut. It helps your microbiome. And 25 grams a day is a goal. So protein and fiber. These are things that I think are non-negotiable for all people, but as we age as women, we need to nourish our bodies. And these are so important. So another thing you can do to control inflammation is control your omega-6s. So you need a nice balance between omega-3 and omega-6. The standard American diet is very high in omega-6s, but eating oily fish helps you. Omega-3s are in oily fish. So are you consuming oily fish a couple times a week? That would be something you could do. If oily fish is not your jam, you need to be doing a daily supplement of omega-3s. Now, believe it or not, I talk a lot about vitamin D. Vitamin D is not really a vitamin. Vitamin D is a hormone. It is a very important hormone for women for breast and vaginal health. Believe it or not, vitamin D is something you can measure. You don't need a prescription. Your insurance is never going to cover it. You can go to any place that draws labs and ask to have your D checked. And your D could be low and still be normal. But vitamin D is really, really important for your bone health and for all these other hormones, because vitamin D is a hormone. So omega-3, check your D, supplement D, 25 grams of fiber, 100 grams of protein, sleep. And if you've ever seen any of my videos, we do need to move our bodies. Yoga once a week, lifting 3 times a week, walking 10,000 steps a day, drinking your water, and you get bonus points from me if you put electrolytes in your water. And that is my Reader's Digest version of women's health without HRT.